Welcome back to the fifth conversation of this series on sickle cell in pregnancy. Now, we will discuss about the care of women with sickle cell disease during intrapartum and postpartum period.
So, let's talk first about labor and delivery.
Does sickle cell anemia necessitate a cesarean section?
No, not at all. The mode and timing of delivery are determined by obstetric indications, just like in any other pregnancy.
So a woman with sickle cell anemia could have a vaginal delivery if there are no other complications.
Absolutely yes. However, it is essential to plan the delivery carefully. We want to ensure that it takes place at a center, with an obstetric high dependency unit or intensive care unit readily available just in case any complications arise.
Okay. And what are some of the things that you do to manage labor and delivery in these women?
So, intrapartum care is really all about anticipating and preventing potential problems. So, we monitor their vital signs very carefully, especially their oxygen saturation levels to ensure adequate oxygenation.
And that's because I guess hypoxia or low oxygen levels can trigger a sickle cell crisis.
Exactly. Yes. And we also make sure they are well hydrated, either orally or intravenously, as dehydration can also precipitate a crisis. And we can use various pain relief options, including epidurals, which are generally considered safe for women with sickle cell anemia.
Okay, so while the cesarean section isn't automatically indicated, careful planning and monitoring are essential.
Yes, and we always have cross-matched blood units ready in case a transfusion becomes necessary, and we also collect cord blood for hemoglobinopathy screening of the newborn.
Okay, that brings us to postpartum care. So what are the key things to keep in mind for women with sickle cell anemia after they've given birth?
Right. So postpartum care really focuses on both the mother and in the newborn. So for the mother, we encourage early ambulation to prevent blood clots, and we continue to monitor her closely for signs of complications.
Okay, what about medications? Should they resume any medications taken before pregnancy?
Yeah. So some medications such as hydroxyurea, if they were taking it before, can usually be restarted after delivery, but the timing might depend on whether they are breastfeeding.
Okay, and are there special considerations for breastfeeding mothers?
Yes, if a woman is taking hydroxyurea, we advise her to avoid breastfeeding for 3 hours after taking a dose, and this just helps to minimize the amount of medication that passes into the breast milk.
Okay, that's important for breastfeeding mothers. What about contraception? Are there specific recommendations for women with sickle cell anemia?
Yes. So we generally recommend progesterone-only contraceptives such as the progesterone-only pill, injectables, or the levonorgestrel intrauterine system.
And why progesterone only?
So estrogen-containing contraceptives can increase the risk of blood clots, which is already elevated in women with sickle cell anemia.
So those are best avoided.
In most cases, yes. And it's clear that managing sickle cell anemia during pregnancy is a very complex undertaking.
Yeah, it definitely is. But with a multidisciplinary approach, careful monitoring and proactive management, we can help these women have healthy pregnancies and deliver healthy babies.
Absolutely. That's a goal, and with the right knowledge and strategies, we can achieve it.
Okay, that's great to hear. Well, this series has been a wealth of information and practical guidance. So thank you so much for sharing your expertise with us.
We hope our listeners found this information valuable and feel better equipped to provide excellent care for their patients with sickle cell disease and trait during pregnancy.
Remember, early recognition, prompt intervention, and a collaborative approach are key to ensuring optimal outcomes. So until next time, keep learning, keep questioning, and keep striving for excellence in patient care.